Thank you for being with us. Could you tell us what is the reason of this event tonight?
Yes, well, we're here supporting Caritas International in their recent report, giving the data on how the programs that they're doing across the world are really working to help people with HIV and AIDS through the prevention, care, and treatment and service delivery. At the U.S. government, through the PEPFAR program, we've been in line, in sync with the faith-based community since the beginning of PEPFAR, and will continue to do so, knowing how important it is that the faith-based community can really work in communities with the type of mission, passion, dignity, but also what this report is showing, getting results that are really helping people. And so we're here to show our support for that effort and the work that we do with UNAIDS and Caritas International.
Is it effective to work with faith-based organizations against AIDS?
Yes, it is. There are organizations that, first of all, treat people with dignity in many ways throughout the course of their illness. And as we heard earlier, they're really working with people and not just thinking about the disease. There are also organizations that really work with the culture of whether it's the town, the city, or the country in which people live. And it's so important because there's lots of different ways that we need to connect and make sure people are able to prevent themselves from getting HIV and getting the type of care that they need. And our faith-based organizations have been our steadfast partners in doing that over time.
And could you tell us what is being done by your government in this field as well?
Yes, well, through the PEPFAR program, we have treated over 70 million people for HIV and AIDS treatment and care. We are continuing to provide prevention services, treatment, and care to people all over the world in the highest burden areas of the world to make sure that we can work as fast as possible with our partners to prevent HIV and AIDS and end the epidemic. And so we're continuing to do that. We will be focusing our field staff and our programs on making sure that we do that because we know we're at a very critical time in the HIV/AIDS epidemic. And so we are focusing our resources and we are working as fast as possible, but also documenting what we're doing, using the data that we have to make sure that what we're doing is having impact. And we want to continue to work with faith-based organizations to do that on the ground.